Hi everyone, and welcome to today's topic, which is insulin. Type 1 diabetics rely on insulin. They have to get an insulin injection every day because of their absence of insulin production. Your type 2 diabetics start out with anti-diabetic medication, which is in an oral or form, and if the oral medication does not control their blood sugar, they will be advanced to insulin. So when we talk about insulin, it's important to know the onset of the insulin injection. So that when insulin is first begins to act on the body, that is your onset. Your peak is the time when the insulin is excreting its maximum action, and then your duration is the time the insulin remains in effect. So it's very important to know your onset, your peak, and duration, especially whenever we are talking about your different insulin types. So we have rapid acting insulin, and your rapid acting insulins, they start to work 5 to 10 minutes after you inject, and they peak 30 to 90 minutes. Rapid acting insulin can be like your Novolog. Next is your regular insulin, or your short acting, and that's roughly 30 minutes to an hour, and it peaks 2 to 5 hours. So your short acting insulin are like your regular insulin. So you have Humulin regular, Novolog regular. Your regular insulins are your short acting, 30 minutes to an hour with a peak time of 2 to 5. Then you have your intermediate acting, and these are your NPH insulins, and they start to work 1 to 2 hours after administration, and then they peak 4 to 12 hours. So this is your NPH, your Humulin N, your Novolin N, your NPH insulins. And then you have those long-acting insulins, and they start to work 1 to 2 hours after you give them, and they generally do not have a peak time. Now we also have some pre-mixed or some combo insulins. You may have a mixture of Novolog and regular insulin, so be mindful whenever you're pulling that insulin out of the refrigerator, which insulin you grab. Read that label carefully. Make sure you grab the correct insulin, because like I said, some are combo insulins, so it may be a mixture of a regular acting and an intermediate acting insulin, so you may make sure that you grab the proper insulin. Now, insulin is administered in units only. We don't administer insulin any other way, so you're going to give units of insulin as opposed to milliliters or milligrams. Whenever you are giving that insulin, or you are teaching that client about giving that insulin, you need to make sure that you are teaching them routes. Make sure that they know to inject in their abdomen, in their upper arm, in the buttocks, in the thighs. Make sure that they know those different areas by which to inject the insulin there. Remember, the only insulin that you can give IV is regular. That's the only insulin you can give IV. And also know that you can mix insulins together. So you can actually mix two different types of insulin together. So here on your slide, I have some instructions for mixing insulin, and I think I have a document for that too. I'll see if I can upload that. So whenever you are mixing your insulin, make sure that you withdraw enough air to equal the amount of insulin you're going to give. So you're going to first inject that into your NPH. You're going to inject that air in there without touching it. And then you're going to inject air into your regular. You will pull out or withdraw your regular insulin, and then withdraw your NPH dosage. And that's how you're going to mix those insulins. Now you have what's called insulin pins, and they have a dialing mechanism on it where you dial how many units you want to give, and then you eject the insulin in those locations that you have designated for that, so you can use that pin for that. You have jet injectors, and they're just high-speed needles, and they also dial in that amount. An insulin pump, now they have come a long way with an insulin pump. So the insulin pump has a little reservoir in it where you place the insulin, and then the pump is really just attached to the body, whether it's on the arm or the abdomen is usually the place, or the arm, and it's just a little box that sits there, and now you can have your blood sugar taken by such devices, and you can have that blood sugar result sent to your cell phone, and then you can send your insulin pump the number of units you need, and it will inject it. So we've come a long way as far as insulin goes and the administration of that. But do know, if you have that client that comes in and they are in DKA, ask them if they have an insulin pump. If they do, they're either going to need to remove that insulin pump, or they need to turn it off, so that you can treat that DKA appropriately with the IV insulin you're going to have to give. And if you have any questions about insulin and administration of insulin, just please let me know, and I will be happy to answer any questions you may have. Thank you.